Like we mentioned before the break, Dr. Christie Alexander from FSU's College of Medicine is back again to answer more of our COVID-related questions.
We love it when she joins us. Dr. Alexander joins us live now. Thank you so much for being with us this afternoon. We appreciate it. Tell us a little bit, when we're talking about COVID cases and the rise, of the rates or hospitalizations, what are you hearing from your colleagues around the state in terms of that?
So in talking to people across the state today, we're still seeing decreases in numbers overall, which is wonderful. What we're also seeing, though, are increases in not as well controlled chronic medical conditions because people have been afraid to come in to their outpatient visits. So while we're seeing decreased hospitalizations and things are looking great that way, we're seeing some increased in issues for patients in the outpatient setting.
All right, important to remember, if you need to go to the doctor, please still do so. Safety precautions certainly in place. Dr. Alexander, this week, one of the major vaccine trials by AstraZeneca was put on hold. Okay, this is a three-part question. The first one is, what happened? The second, how common is it to halt a trial? And the third, what does this mean moving forward?
This is a great question. Yes, they did put their trial on hold. They were in phase 3, the phase 3 portion of their trial. What happened was one of the participants started to develop an adverse reaction. They think what I've seen is that it was neurological in nature. Wow. And so it is extremely common to halt a study when someone develops a reaction in order to determine whether that reaction is from the vaccine or just by chance they got this particular condition. This happens very, very frequently. We just don't hear about it as often as we are right now because everything's in the news about these vaccines. But it's a very, very common thing, and the reason being is because anything that we put through a trial, we want to make sure that when we send it to the FDA, it's completely vetted, fully safe, and fully efficacious for use on a bigger scale. So when we as physicians prescribe a vaccine or prescribe a medication, we can feel sure that that vaccination or medication is safe with minimal side effects. So very, very common, nothing to be worried about. And if this person, if they find that it's not from the vaccine, the trial will resume. Okay. There are 9 other vaccines in phase 3. So, there are several that are still up and running and not temporarily shut down. And as far as how often this happens, like I said, it happens quite often. So it's what you want in a study. This is why we don't want to push things through too quickly.
Well, yeah, we are learning a lot about how this whole process works. A viewer actually sent us a question, and they were asking about people who survived the virus with few or no symptoms, but then end up developing some chronic conditions on the back end. We've read some different kind of articles about that, some heart issues, lung issues, that sort of thing. Can you talk a little bit about these lingering issues that people are seeing, and how common is it?
That's another great question. As a matter of fact, when I was talking with one of my colleagues in South Florida, she said she's starting to see the sequelae of ongoing symptoms that you just mentioned. She mentioned specifically dizziness, ongoing fatigue, shortness of breath, ongoing loss of taste, that sensation of taste. So we're starting to see that, and there have been some studies run about post-COVID syndrome that include all of those things, plus rashes and ongoing heart and lung problems, things of that nature. So there's a lot more that we need to study on this to see how much of it is from COVID-19 specifically, and how much of it is just from being really sick in general. The body's inflammatory response acts up, and our immune modulators are on. It is part of the reason why this is happening long term. We have to remember that we've only known about COVID for about 6 months in the United States. So to know whether this really will become a chronic situation will take more time. But we're definitely monitoring all this really, really closely to determine how best to treat our patients post-COVID.
Yeah, we're going to continue to learn so much more as time continues to pass. Okay, last night the announcement made that the state of Florida going to allow bars to reopen Monday at half capacity. They tried this before and then had to shut them back down shortly after. Restaurants, as we know, already open, but there's a new study showing that going to these types of places can actually raise your risk. What can you tell us about that study?
Yes, this is a study that was done by the CDC. It included it included 314 people, 54 of which tested positive for COVID-19. This was a study run through 11 different centers across the states. And in those people that tested positive, while both those that were positive and negative did a lot of things in the community, like go to the grocery store, things like that, those that tested positive had gone to eat at a restaurant within 14 days of testing positive. So that's what made this study unique. One of the limitations of the study was that there was no indication as to whether the people dined inside or outside, so more information is needed in that regard. But if it was an indoor situation, the way this applies to bars is we already know that in poorly ventilated areas with not enough circulation, transmission is higher. So when we're opening up indoor centers such as bars or things of that nature, we need to be keeping that in mind. So we really do have to assess our own risk as to whether we want to take that risk of going to a bar where inhibitions might be lowered by consuming alcohol, for example, and it's kind of difficult to wear a mask when you're eating or drinking. So that's also part of adding into why we're seeing those rates increase when we're eating inside or drinking inside.
Dr. Christie, as always, it's great information that you're giving us. Is there anything else that you would like to add or any reminders as we go into the weekend?
Yeah, for those of you going to the game, thinking about tailgating, make sure that you continue to socially distance, wear your mask, wash your hands often, especially before you eat, and avoid touching your face, particularly your eyes, nose, and your mouth, as much as possible. So as much as we all want to have fun and have a great time and be around our friends and enjoy football season, we still have to be safe because COVID is very much alive and real.
Okay, a great reminder, Dr. Alexander. We're going to ask you a 4-part question next week. We're going to up the ante, okay?
I'm ready. I'm ready.
Yes,
I'm ready.
I'm sure you are, and we appreciate the knowledge as usual.